everybody, this is Dr. Ron. I want to do a quick review on the Prolon Fasting Mimicking Diet program. And this program is very interesting. It's a 5-day fasting mimicking diet. What that really means is that over 5 days, your body thinks it's fasting, but it's really not. And a lot of the studies that have gone into this has been absolutely astounding. In fact, the mastermind behind the fasting mimicking diet and his book, The Longevity Diet, is Dr. Valter Longo out of University of Southern California Longevity Institute. And he was just recently named one of Time Magazine's, one of the top most influential people in the world. And so it's really exciting to see that. But real quick, this is the actual kit that comes with it. And this is it's labeled Prolon. And inside the kit are several different things. So I'm gonna go through it one by one with you guys. And I'm gonna tell you why I think it's pretty cool. So first is labeled 1 through 5. So this is day 1. And there's contents within here, and everything you're supposed to consume is in this box with the exception of water. And so there's different soups. It's plant-based, it's vegan, it's organic, and there's different soups and everything that are in there. There's a special type of cracker. There are these really delicious bars called nut bars that are in there. And these are put together in a very scientific fashion of not just optimizing the macros, but optimizing the micronutrients that's required to keep your body in that fasting mimicking state. And the studies that have been done on this is absolutely fascinating. So that was day 1, and there's day 2 through 5, and they're all in very similar boxes of different things to do. And it's a calorie restricted program for 5 days, but the effects after the 5 days last a very long time. And so one of the great things about it is that it's easy. It's just adding water to whatever is in here, and every time you do it, it's a little bit different. And whenever you want to go through a process of healing and change your gut microbiome and feeling better, this is really the go-to for a lot of our patients. The research shows that this is also one of the quickest ways to change your gut bacteria, to change your gut microbiome. Now, the gut microbiome is associated with a lot of different chronic diseases, depending on the diversity index, how diverse it is. If it's not as diverse, then there can create a lot of inflammatory problems in the gut, which leads to a lot of autoimmune disease, a lot of toxicities. And so this is a really quick way to change the microbiome. And studies show that after 3 consecutive rounds, month after month, after 3 months, we're able to see drops in different cardiovascular markers in the bloodstream. Anything from apolipoprotein B and triglycerides and insulin resistance, hemoglobin A1C. And these are markers that we look for as physicians to figure out whether someone is in a particular metabolic state. So that's why I'm really excited about this. Another thing that I didn't expect with this program, especially after doing it a couple times myself, is that different people can have different responses to it. Now, some people go into the program, but unfortunately they have almost what we call a food funeral, where they're either drinking alcohol or they're not eating the best food prior to starting the program. That's not the best idea. People tend to do poorly on it because they have more symptoms of this low sugar hypoglycemia crash. But those people who clean up the diet just 1 to 2 weeks prior to the program, they do exceptionally well. And so we're talking about weight loss and fat loss and decrease in visceral fat, which is the fat that's surrounding your organs, which is the target of what we're trying to do in metabolic health. There are people who go through it and they come through it with a certain sort of emotionality, meaning that some people will feel very good on certain parts of the program, and some people don't feel as great. But that's a lot of individuality that goes with it. For example, what we found in our clinic is that women don't tend to do well on this if it's done on certain parts of their menstrual cycle. For postmenopausal women, that's actually not even an issue. Men tend to do a little better on the emotionality side and tend to have a better effect on decreasing body fat percentage in our particular clinic. I personally find it very, very useful. I find the program very easy, and I had a significant decrease in my visceral fat after 2 months, two rounds, and I'm wondering what it is after the 3rd round. Another portion of the Prolon Fasting Mimicking program is that people know that, hey, this is a 5-day program, but it's just a 5-day program. Where do I go after that? Where do I go after the 5 days? Well, in between the 5 days and then maybe the next round of Prolon the following month, I do encourage people to eat cleanly and eat something what I like to call a circadian rhythm fasting diet, where you're only eating during the daytime. It actually helps your hormonal balance with the cortisol and melatonin. It helps your growth hormones starting to be more stabilized. And when you get prepared for that second round of the Prolon fasting mimicking diet, you tend to do better. And everybody has a different experience every time they do it. So from the first time you do it to the fourth round that you actually do it, it's a very different experience. But the most exciting part about the program is what happens between days 3 and 5. Between days 3 and 5, you have upregulation of this concept called autophagy. Autophagy is your body basically cleaning up the damaged cells. It's like Pac-Man, cleaning up the damaged cells. And on day 4, you have this huge upregulation of your stem cells, and these stem cells are what's trying to heal your body. So taking away the damage, building new stuff on it. And on day 6 and on, what you're doing is that you're actually eating to feed your new stem cells that are there. And so that it's almost like having a new lease on life. I find this program very, very exciting, and it's easy to do, and we've seen some remarkable results. So I hope you guys enjoy this quick review. It is something that I'm going to continue to talk about, so stay tuned. Thanks very much.